Are you looking at your nails right now? Because what you're about to discover in the next few minutes could genuinely save your life. Most people think nails are just a cosmetic concern, something you paint, trim, and forget about. But what if I told you that your nails are actually one of the most powerful diagnostic windows your body has, and that right now, today, they might be trying to warn you about something serious happening deep inside your body that you cannot yet feel, cannot yet see anywhere else, and that your doctor might not even think to check unless you specifically ask? The truth is, five specific changes in your nails are directly linked to terminal and life threatening diseases, and millions of American seniors are walking around with these signs every single day, completely unaware of what their own hands are trying to tell them. I'm Dr. Sarah Brooks. I've been practicing medicine for over 20 years, and today I dedicate my work entirely to helping seniors live healthier, longer lives. And I have to be honest with you, this is one of those topics that I feel genuinely urgent about sharing because in all my years of practice, I have seen patients come in with advanced heart disease, late stage lung conditions, severe liver failure, and dangerous blood disorders. And when we look back at their history, the signs were right there on their fingernails months, sometimes years before any other symptom appeared. So please stay with me through this entire video because what I'm about to share could be one of the most important things you watch this year. You are not alone if you've never thought to look at your nails as a health indicator. Most of us were never taught this. We were taught to watch for chest pain, shortness of breath, unusual lumps, but nobody sat us down and said, look at your nails carefully every single month because they are quietly keeping score of everything happening inside your body. Well, today that changes. Today I'm going to walk you through five nail signs that medical science has directly connected to serious and potentially terminal conditions. I'm going to explain exactly what they look like, why they happen, what diseases they point to, and most importantly, what you should do the moment you notice them. Before I go any further, if any of what I just said sounds familiar, if you've noticed changes in your nails recently and just brush them off, please go ahead and hit that thumbs up button right now. It helps other seniors find this content, and honestly, it means the world to me knowing that this information is reaching the people who need it most. Now, let's talk about why nails are such a powerful health indicator in the first place, because understanding this will help everything else I share make a lot more sense. Your nails grow from a structure called the nail matrix, which is a small tissue bed hidden under the base of your nail. And this matrix is constantly fed by blood vessels and requires a steady supply of nutrients, oxygen, and healthy circulation to produce strong, normal looking nails. This means that anything that disrupts your circulation, your oxygen levels, your liver function, your kidney health, your nutritional status, or your immune system will show up in how your nails look, feel, and grow. Doctors and researchers have known this for decades, and in fact, nail examination has been a part of thorough physical assessments for over a century. But somewhere along the way, it got lost in the rush of modern medicine, where appointments are short and technology does most of the talking. So let's slow down today and give your nails the attention they deserve. The first nail sign I want you to look for is something called clubbing. And I want you to pay very close attention here because this one is particularly serious. Nail clubbing happens when the tips of your fingers enlarge and the nails curve downward around the fingertips, almost like the back of a spoon turned upside down. If you look at your finger from the side, a normal nail sits at roughly a 160-degree angle where it meets the skin, but with clubbing that angle disappears and the nail almost seems to float upward at the base while the tip curves down and the fingertip itself becomes soft and spongy. Now, here's why this matters so much. Clubbing is almost always a sign that your body is not getting enough oxygen over a prolonged period of time, and the conditions most strongly associated with it include lung cancer, chronic obstructive pulmonary disease, which many Americans know as COPD, congenital heart defects, and serious inflammatory bowel diseases like Crohn's disease. Research indicates that clubbing is present in up to 35% of patients with non-small cell lung cancer, which is the most common form of lung cancer in America. And what makes this so alarming is that lung cancer is notoriously silent in its early stages. It doesn't hurt. It doesn't always cause a cough right away, but the nails can start showing this warning sign while the disease is still in a stage where treatment is far more effective. I remember a patient of mine, a 72-year-old retired school teacher from Tennessee named Margaret, who came in for a routine checkup and mentioned almost as an afterthought that her fingers had been looking a little different lately. When I examined her hands, I immediately noticed mild clubbing that had clearly been developing for some time. She had attributed it to arthritis. A chest x ray and subsequent CT scan revealed a mass in her left lung that we caught early enough to treat successfully. Margaret told me later that she had been meaning to mention the nail changes for almost 8 months, but kept assuming it was nothing important. 8 months. Please don't make that same assumption. And this brings me to something I need to address directly because I know many of you watching are thinking, well, maybe that's just how my nails have always looked. Or maybe it's just age. And I want to gently but firmly push back on that. While some nail changes can be normal parts of aging, clubbing is not one of them. Clubbing is not a normal part of getting older, and it should never be dismissed without medical evaluation. If you think your nails might be showing signs of clubbing, the right move is to bring it up with your primary care doctor as soon as possible and ask specifically about it. Because in a short appointment, it might not get noticed unless you advocate for yourself. Now let's move into the second sign, and this one affects millions of American seniors who have no idea what it means. I'm talking about a condition called Terry's nails, named after the physician who first described it, and it looks like this. Most of the nail, roughly the inner 80%, turns a pale whitish color, almost like frosted glass, while a narrow, darker pink or reddish-brown band appears at the very tip. The whole nail looks washed out, dull, and almost colorless except for that distinctive dark strip at the end. Now, this might sound subtle, but the science behind it is genuinely alarming. Terry's nails are caused by a decrease in the number of blood vessels in the nail bed combined with an increase in connective tissue, and research has found them to be strongly associated with liver cirrhosis, congestive heart failure, type 2 diabetes, and chronic kidney disease. According to studies published in medical literature, Terry's nails appear in approximately 80% of patients with liver cirrhosis, which tells you just how powerful this diagnostic sign can be. The liver is one of the most quietly suffering organs in your body. It can lose up to 70% of its function before you start feeling noticeably sick, which is why liver disease so often gets caught late. But the nails show the strain much earlier. If you're an American senior who enjoys the occasional glass of wine with dinner, or who takes multiple medications that are processed through the liver, which honestly describes most Americans over 65 who are managing multiple health conditions, paying attention to your nail color is not something you can afford to skip. The same goes for heart failure, which affects nearly 6 million Americans and is one of the leading causes of hospitalization in people over 65. Terry's nails in a patient with mild fatigue and slightly swollen ankles can be the combination of signs that leads to a heart failure diagnosis while there's still time to intervene meaningfully. If this video has already opened your eyes to something you hadn't considered before, please give it a thumbs up right now, because your engagement helps this content reach other seniors who need this information just as much as you do. The third nail sign is one that many people have seen but few people connect to serious disease, and it's called Bowes lines. These are horizontal indentations or grooves that run across the nail from side to side, almost like a speed bump pressed into the surface of the nail. They can appear on one nail or on multiple nails at the same time, and their position on the nail can actually tell a doctor roughly when the health crisis that caused them occurred, because nails grow at a fairly predictable rate of about 3 millimeters per month, which means a groove located near the base of the nail happened more recently than one near the tip. Bowes lines form when nail growth is suddenly interrupted or severely disrupted by a major physical stress on the body. And the conditions linked to them include heart attacks and severe cardiac events, uncontrolled diabetes, peripheral artery disease, severe infection or sepsis, chemotherapy, and significant nutritional deficiencies. Now, here's what makes Bowes lines particularly tricky. Sometimes they appear after an illness that you knew you had. Maybe you had a serious infection or you went through a difficult medical procedure, and in that case, they're not necessarily telling you something new. But other times, Bowes lines show up and the person has no idea what caused them. They don't remember being noticeably ill, and that's when they become a real red flag because it can mean that something serious happened in your body that went unnoticed at a symptomatic level, but was severe enough to stop nail growth entirely. Doctors explain that a deep or very wide Bowes line suggests a more prolonged or more severe disruption, while a shallow line might indicate something briefer. Either way, if you see these grooves on your nails and you can't immediately connect them to a known illness or medical procedure, please talk to your doctor. You want to know what your body went through. I had a patient, a 68-year-old man from Georgia named Robert, who came in after his wife noticed deep horizontal grooves across nearly all of his fingernails. Robert had attributed them to his nails simply growing oddly. He felt generally fine, or so he thought. When we ran a comprehensive workup, we discovered that Robert had been experiencing microcardiac events, very small but significant disruptions to his heart rhythm that hadn't been severe enough to cause the classic crushing chest pain, but had been putting serious strain on his cardiovascular system for months. The Bose lines were his body's way of keeping score. We got Robert on the right treatment plan and changed the trajectory of his health entirely. His wife still tells me those nail grooves saved his life. In just a moment, I'm going to share a simple home assessment protocol that you can do right now with just a few minutes and good lighting. So stay with me because this is genuinely useful and I don't want you to miss it. But first, let me tell you about the fourth nail sign, because this one is connected to a condition that is silently devastating the health of older Americans at a rate that most people don't fully appreciate. The fourth sign is called koilonychia, sometimes called spoon nails, and it looks exactly like the name suggests. Instead of curving naturally downward the way a normal nail does, the nail flattens out completely and then curves upward at the edges, creating a concave shape like a tiny spoon that could theoretically hold a drop of water. The nail may also appear thin and brittle. Koilonychia is most strongly associated with severe iron deficiency anemia, which affects a significant and often underdiagnosed portion of the American senior population. And it can also point to hemochromatosis, which is a genetic condition where the body absorbs and stores too much iron, heart disease, and hypothyroidism. Now, iron deficiency anemia might not sound like a terminal diagnosis on its own, but here's where it gets serious. In older adults, iron deficiency anemia is frequently a symptom of an underlying condition rather than a cause in itself. And the underlying conditions include gastrointestinal bleeding from colon cancer, stomach ulcers or polyps, celiac disease causing malabsorption, and chronic kidney disease, among others. So, when spoon nails appear in a senior, the right medical response is not just to prescribe iron supplements and move on. The right response is to investigate why the iron is low in the first place. And that investigation has led to early cancer diagnoses in many of my patients over the years. Science has already shown that the body prioritizes which tissues receive nutrients when supplies run low, and unfortunately, nails and hair tend to be at the bottom of that priority list, which means by the time you can see the effects of iron deficiency in your nails, the deficiency has often been significant for quite some time. This is also why nutrition matters so profoundly for seniors. Eating iron-rich foods like lean red meat, spinach, beans, lentils, and fortified cereals is genuinely important, not just for energy levels, but as a way of protecting your body from falling into the kind of deficiency that forces your nails to start reshaping themselves. Now, let me share with you a simple home nail assessment protocol that I recommend to all of my senior patients, because I want you to be empowered to monitor your own health proactively between doctor visits. I call this Dr. Brooks's 5-minute nail check. And all you need is a bright light, either natural sunlight near a window or a good lamp, and maybe a magnifying glass if you have one handy. Start by washing your hands thoroughly and drying them completely, because moisture can temporarily change how nails look. Then sit comfortably near your light source and examine each hand separately. Look at the overall color of each nail from the front. Are they pink and healthy looking? Or do you notice any unusual pallor, white discoloration, or yellowing? Then look at each nail from the side to check the angle and curvature. Are the nails curving normally downward? Or do you notice any upward scooping or downward clubbing at the tips? Next, run your fingernail very gently across the surface of each nail to feel for any ridges, grooves, or indentations running horizontally. Then look at the white portion at the tip compared to the nail body. Is there a clearly distinct darker band at the very tip with a pale body, which might suggest Terry's nails? Finally, gently press on the center of each nail and release. The color should return quickly when you release, Slow return of color can suggest poor circulation. Do this check once a month and write down anything that seems different from your last check. Keep a simple note on your phone or a small notebook. This takes 5 minutes, and the information it gives you is invaluable. Now, before I get to the fifth nail sign, which is in many ways the most alarming one I'll discuss today, I want to mention something for those of you who want to go even deeper with your health monitoring and get access to more detailed home assessment guides, personalized advice, and exclusive content that I don't share in my regular videos. If you become a member of this channel, you get all of that and more directly from me to you with the kind of detail that just isn't possible to fit into a single video. Membership is a small investment that could make a genuinely significant difference in how proactively you manage your health, and I'd love to have you join our community. Now, the fifth sign, and I need you to really pay attention here because this is the one that I see most commonly dismissed, most commonly attributed to something harmless, and most commonly connected to conditions that are genuinely life-threatening if caught late. I'm talking about yellow nail syndrome, which is exactly what it sounds like. A yellowing of the nails that goes beyond what you might expect from normal aging or nail polish use. But here's what makes yellow nail syndrome different from simple nail discoloration. In yellow nail syndrome, the nails don't just turn yellow, they also thicken dramatically. They slow their growth to almost a standstill. They lose their cuticle entirely, and they may start to separate from the nail bed at the edges. The surface may appear excessively curved from side to side, almost like a hump. And the conditions linked to yellow nail syndrome are among the most serious in all of medicine, including lymphedema, which is a condition involving the lymphatic system, chronic respiratory diseases, including bronchiectasis and chronic bronchitis, pleural effusion, which is an abnormal accumulation of fluid around the lungs, rheumatoid arthritis, and in some cases, it has been associated with certain malignancies. The lymphatic system connection is particularly important because the lymphatic system is your body's internal drainage and immune surveillance network. And dysfunction in the lymphatic system can allow cancer cells to travel more freely and can indicate that the immune system is under serious strain. Research indicates that yellow nail syndrome is rare, but when it appears, it warrants thorough investigation rather than reassurance. What concerns me most as a doctor who works with older Americans is how often I've seen yellow nails dismissed as a cosmetic issue, attributed to old nail polish, to fungal infections which do cause yellowing but look different on close inspection, or simply to age. Yes, nails can take on a slightly yellowish tint with age due to protein changes, but the thickening, the slowed growth, the loss of cuticle, the separation from the nail bed, these are not normal aging, and they should never be waved off without evaluation. I want to tell you about a patient named Dorothy, a 75-year-old woman from the Pacific Northwest who had been painting her nails regularly for decades. When she stopped using nail polish for a few months during a trip to visit her grandchildren, her daughter noticed that her mother's nails looked thick, deeply yellowed, and seemed almost still, not growing at all. Dorothy had assumed this was just what her nails looked like under the polish and had never thought to investigate. When I examined her, the nails were absolutely consistent with yellow nail syndrome, and the subsequent workup revealed significant pleural effusion and early-stage lymphatic involvement that had been building quietly for an unknown period of time. I can't tell you with certainty what the outcome would have been if her daughter hadn't noticed those nails that summer, but I can tell you that catching it when we did gave Dorothy's medical team options that would not have been available 6 months later. This could be putting your life at serious risk if you're dismissing nail changes as trivial. And I say that not to frighten you, but because every single day matters when it comes to early detection of serious disease. The longer you wait, the harder it gets to achieve the outcomes that we all want. And that is you, living with health, independence, and strength for as many years as possible. Now, I want to take a step back and look at all 5 of these signs together because there's something incredibly important I haven't mentioned yet, which is that the combination of multiple signs is often more significant than any single sign in isolation. If you have Terry's nails and also notice some Bo's lines, that tells a very different story than if you have one or the other alone. If you notice clubbing alongside some yellowing and slowed growth, that's a conversation you need to have with your doctor, urgently, not next month at your scheduled appointment, but this week. Your body communicates in a language of systems, and your nails are often speaking multiple sentences at once. Learning to read them comprehensively is a skill that I genuinely believe every American senior should have, and that's exactly why I wanted to make this video.